Thank you. I want to acknowledge Ms. Presley once again and her leadership. Having been a resident of Boston many years ago and having worked for the Boston Juvenile Court many, many years ago, Massachusetts, the Commonwealth, has done a lot of great work, and you have been at the forefront of that. I also want to recognize the witnesses from the first panel and the one who's still here. In my view, you are so powerful, and what you did today made you and your three colleagues at the first panel the most powerful people in Washington, D.C., and it's transformative. Having had this experience in multiple generation of addiction and abuse with my parents, with my siblings and with children in my family, I have visited this issue as a personal issue and a private issue. I'm reminded sitting here with this panel many years ago when I was a county supervisor, and then Governor Pete Wilson, a Republican, introduced the California Continuum of Care for Children and Families, and an advocate at one of the hearings saying, this is like a metaphor for there's a group of parents by the side of a rushing river, and children, young children, are drowning in the river going downstream. And the parents, the adults, kept jumping in the river, saving one at a time. And then finally, one of the parents said, somebody needs to go upstream and find out why these kids are going in the stream. And 30 years later, I still think of that. So in this context of knowing the 30 years since my father took his life to now, we are at this inflection point. The exponential research Dr. Hari and I talked about yesterday, being from the Bay Area, we talked about Moore's Law and technology. The research in neuroscience puts that to shame. I tell my kids, when we look back at this period of time, when they do, and their kids, they will look at us as both barbaric, but as transformative if we do what we need to do. So we know with the ACA and with parity, we have 75% more requests for referrals, even with this broken infrastructure. But to the point from a gentleman, about 25% less people going into the professional classes to serve these people. So the two things I would question Dr. Horry and Dr. Bethel in particular are costs. We talked about this yesterday when we met. CDC says that estimates in 2015 that maltreatment of kids going upstream is $2 trillion a year in the United States. And besides the human cost that we've heard about. And for all of the examples that we heard today about people overcoming, and I would recommend Supernormals by Meg Jay, a wonderful researcher, or anything written by Kate Jameson, who's a survivor of her own suicide. The more we go upstream, but we're losing people because we don't have the infrastructure to match the increasing neuroscience and evidence-based research. Now, in this Congress, we were able to do bipartisan good work on evidence-based research when it came to the criminal justice system. It wasn't perfect by my standards, but we agreed that the science would inform our decision-making process. So we have that cost, and then as a survivor of cancer, I am very appreciative. I went to see my oncologist today. The cancer I have, 15 years ago, I would be dead. But now I've got an extended lifetime. NIH says that $77 trillion since 1974, their research has contributed to the U.S. economy, $77 trillion, because investments in science and research. So how do we take the fact that people lose their lives 14 to 32 years sooner if they don't have the treatment they need, and then the cost, both individually and to the whole society, and then the examples of when we got this right, cancer being one of them, cardiovascular disease. When we accepted what you did at CDC and what people did at NIH, and then deployed it, Dr. Bethel, using the infrastructure as best we can that we have, to Ms. Presley's comments about juvenile justice. Recently, I was in our juvenile hall, which I was an advocate to rebuild when I was a county supervisor 15 years ago. The judges and the DA told me, it's not big enough. We're going to have to find other space. It's now 60% to capacity. I asked a former presiding juvenile office chief, who was a friend of mine, what happened? And she said, we took all of those programs that were evidence-based research, and now the kids aren't in here. They're out in the community getting the services they need, and they're not hurting themselves or anyone else. So those two things, first, Dr. Horry, how does the Congress approach this from an evidence-based research, use that research, as we did with criminal justice reform, and get to the savings and the life expectancy changing in our lifetimes or sooner?
Thank you. Well, I would say prevention saves lives. When you look at number of adverse childhood experiences, we've seen that if you have like 6 or more, decreases life expectancy by 18 to 20 years. So I think that's one thing right there. If we can impact early on reverse these traumas, buffer them, that'll impact life expectancy. On our website, we have information on evidence-based programs, child parent centers, and nurse-family partnership. Every dollar spent on a nurse-family partnership saves $6.38. I plugged in the chairman's state of Maryland just to see what would happen if they implemented it statewide. They would save over $200 million in substantiated child abuse cases. That saves money. And you look long-term, all the other health impacts that Dr. Bethel and Dr. Shervington talked about with cardiovascular disease, diabetes, substance use, that early investment in prevention will have that long-term impact.
Dr. Bethel, we're having the bells ring, so we want to go vote.
Okay, great.
I feel sorry that I've had to tell people be concise for
I would
something we clearly all want to talk about for a long
I
period of
just
time.
want to really support your statement that this is a crisis. The Children's Hospital Association has put out a report on how it's a matter of national security, what's happening even just when we look at the lack of flourishing of children and how that might play out for our adulthood. We need a stream of launch and learn supports that allow us to use the best evidence we have and create citizen science platforms, and in every NIH RFP that's about human health needing to look at this to advance the science in all of our systems and professional associations. But most importantly, healing is prevention. We are at a point in this syndemic, meaning it has escalated to a point that even if you don't have ACEs, you're impacted. And so it's all of us, and healing has to lead the process for prevention, because if we offer things and they're not used because there's too much trauma, it's not going to really work. But the through any door investments need to happen. Like, we built the roadways, and we had to invest in those roadways so that we could build this nation. We need to build the social infrastructure, and that will play out, and it's time for that investment when our sciences and our lived experience can finally meet policies that pay for and invest now, because we will save later, and we will also have a lot more joy and well-being as a country.
Well said. I think that's as good a place as any to conclude, but also say that I want to thank the chairman, Mr. Cummings in particular, and again, Ms. Presley, for their interest in my colleagues on this bipartisan, very important hearing, and again to the panelists on this panel and the previous panel.